All right. Well, unfortunately, we're going to get back into the habit, I think, of doing these briefings more regularly because there's no doubt about what's going on with COVID and what we need to be doing. Yesterday, the governor, all right, John, I got a clicker, it doesn't work. So yesterday, the governor and the state health department issued some orders. All right, maybe they've solved that now. Okay. All right, let's hope this works. The governor issued some orders. I'm going to show you why she did it and why she had absolutely no choice. It's extremely disappointing to hear the president's medical advisor attack her for it, and I'm going to show you why that is just beyond belief. But let's come back to the last time that I was here talking to you about COVID data. And I'm going to just keep doing what I've always done, just give you the facts, show you the details. So we stood here on October 21st, a little less than a month ago, and I showed you the COVID hotspot map for the United States. And Wisconsin was very heavy. The redder this is, the more intense the COVID spread is. And Michigan was starting to turn yellowish, getting more infected as this spread through the Midwest. Here is that same map today. The Midwest is absolutely covered in COVID. The governor didn't take her action because she wanted to get people angry at her. She actually looked at this science and said, I'm going to protect the people of the state of Michigan. And I want to talk about the 7-day positive infection rate, the percentage of people who were tested who came in positive in southeastern Michigan. In the last when I was here on October 21st, what we showed you was the city of Detroit had far and away the lowest infection rate of the state at 2.5%. And at the time I talked about suburban Wayne was at 5, suburban Oakland at 6, suburban Macomb at 8. That what we were seeing was behavior in the surrounding suburbs that in my mind was completely irresponsible. You just drive through any of the suburbs, you're seeing people out without masks. In the city of Detroit, by and large, our folks have taken this very, very seriously. And I said at the time, we can't put a wall around our city, but this is the reality of what we're dealing with. When the governor took action yesterday, here's the current infection rate. Detroit's higher at 6.8%, but look what's happening in the surrounding suburbs. Wayne has more than doubled to 12.6, Oakland upwards of 13, and Macomb at 17%. I've been listening to complaints all day from restaurant owners in Detroit, from casinos in Detroit, saying, we've done a great job. We follow the protocols. We don't have outbreaks in our restaurants. We don't have any sign of outbreaks in casinos. Why does the governor's rule have to apply to us? But the reality is she has to treat us as a region. And what I have to say to you is this, there's no question about it. City of Detroit businesses are being shut down now because of irresponsible behavior in the surrounding communities. So think about what the governor's choice was. Had she treated Detroit as its own region, as somebody might have argued for, and Detroit was the only place in southeastern Michigan where restaurants, casinos, entertainment were open, all of the folks in these surrounding areas with these ridiculous infection rates would have had one place to go. And it's not just Wayne, Oakland, and Macomb. Monroe and St. Clair and Livingston and Grand Rapids, they're all at 14, 15% infection rates. We would have been the magnet for all of the highly infected groups in this state to come here. And so while I know it doesn't seem fair to the casino operators and the restaurant operators in Detroit, as well as you have done, and you have done an outstanding job, there is not a wall around Detroit. And so the governor did what she had to do. One of the things I'm most proud of is the businesses in this city. You have been safer at work in Detroit than at home. If you look at our manufacturing facilities, our auto plants, you look at our construction sites, we've had virtually no sign of outbreak because people have followed the protocols. But when you have a business that's open to the public and can attract from the region, the governor has to have a different approach. And there is no description for Scott Atlas today in his comment about rise up against the governor, except to say the guy is behaving like a moron. There's no other description for this. And I want to say to my friends in Wayne and Oakland and Macomb County, look at what is happening. Oakland, you've gone from 5.7 to 13% in a month. If it goes another month and nothing changes, it's going to double. You're going to be at 26% by Christmas. Macomb, you're going to be over 30% by Christmas. I spent 9 years in the hospital business, and every winter we knew that the seasonal flu would come up in November and spike out in January and February. Every hospital administrator counts on that. This is our first winter with COVID, but it looks like it's trending on that line. If that's true, you could be in a situation where 1 out of 3 or 4 people in your community has COVID. That's the basic math that you're looking at. And if the governor had sat by and done nothing, we would have had a great deal of jeopardy. And so it really is important that everybody take this seriously. And if you wear a mask, it works. What has happened is this. This isn't spreading outside. I mean, we had protests all summer long with hundreds of people on the street. They were wearing masks and they're outside. We had no spike. But as you move indoors and you take the mask off, and this is where it's spreading. It's spreading in your homes. It's spreading in your private gatherings. It's spreading nights and weekends. When you go indoors, you need to wear your masks. That's what's causing this. And part of the limitation on the governor's order is, even if you stay in your house and continue visiting each other and having parties on weekends, it's not going to slow the spread unless you think about the fact you are far more at risk indoors than you are outdoors. And the colder it gets, just like the seasonal flu, it appears COVID is spreading faster. Now, people in the city of Detroit ought not to take comfort from this 6.8% rate. And so when Denise Fair and I stood here in October, we told you we were getting concerned about the hospitalizations. These are the number of people hospitalized in the city of Detroit. And we said in October we've gone from 46 to 71 in 2 weeks. Here's where we are now. We're up to 146. We're doubling every 2 or 3 weeks. And here's what we know, that 1 out of 10 people who goes into the hospital on average dies of COVID. And we know for African Americans, that fatality rate is higher than it is for Caucasians. But we can tell you that the odds are, with 146 people in the hospital today, 14 of our neighbors who are there are going to die. If this trend line doesn't change, in another 2 weeks, we're going to be at 300. And 2 weeks after that, we're going to be at 600. This is the trend line that we are on, and it's why we have to act and we have to take this seriously. And so what I want to talk to you about today is the governor has done what she has done, but given the fact that African Americans die of COVID more often than Caucasians, the city of Detroit can't just do what the rest of the state's doing. We've got to go farther. We have gone farther. There's a reason we've led the country in knocking the infection rate down. A big part is Detroiters have been so cooperative in committing to the masking and the distancing. But let me tell you what we're going to be doing for the next few months. I know the governor has said it's a 3-week shutdown. If you look at the historic trends on flu, there's no reason to think in January it's going to get easier. So we'll see. Maybe it will only be 3 weeks, but I think we're probably looking at a 3-month fight here. So here's what we're going to do. We are providing immediate testing to all Detroiters, regardless of insurance or prescriptions. You can call and get an appointment. You can get in tomorrow. We've moved from the fairgrounds because it's cold, and we've moved to the Williams Recreation Center that's at 8341 Rosa Parks. It's opening Monday through Friday, 9 to 5. If you're not familiar with it, you take the Lodge to Claremont, get off the Claremont exit, and go a few blocks west. And that's where it sits. 12th and Claremont, of course, is a area very familiar to longtime Detroiters, know exactly where it is and what the history is. Now it is a site of health and protection. Here's what we're doing, though, if you notice these pictures, is that we have options now both inside and outside the building as it gets cold. But here's what happens. You can call today and get an appointment tomorrow. You will get the results in 24 to 48 hours. We've got the only place in the country where if you want to test, symptoms, no symptoms, doesn't matter. You want to test, you call today, you can get in tomorrow, and you'll have your results within a day or two. That's what we need to do, because the fastest way to stop the spread is for you to know whether you're infectious or not. Here's what's going to happen when you pull up, and you can see the pictures here, if you can see them, of the parking lot. So we've got a mix of inside and outside testing now. If when you pull up at the Williams Center that you're disabled, you can't make it out of your car into the building, we will come out and swab you in the car. If you have symptoms, we don't want you to leave your car. We will come out and swab you in the car. So as soon as you show up, you'll call a number and the staff inside will talk to you. And if you've got symptoms, we will come out and swab you in your car. We do not want you coming into other people. If you don't have symptoms, we're going to want you to come inside and we'll test you inside. It's certainly a lot easier for our staff, particularly as it gets colder and colder, to keep our staff inside as much as we can, and it's more comfortable for you. So for those of you who are familiar with the fairgrounds, it worked amazingly well. Everybody got in a line. Everybody went through the line. That was warm weather time. This is our adaptation for the colder weather, is either testing in your car or testing inside if you're ambulatory and you don't have symptoms. And so if you want that test, Detroit is making it available to you. We also have, because of our outstanding health department, some other actions the city of Detroit is taking that is beyond the rest of the state. And with that, I will turn it over to our great health director, to Denise Fair, to talk about what the Detroit Health Department is doing to protect this city.
Thank you, Mr. Mayor. So today I'm going to highlight the proactive enforcement steps we are taking to keep the public safe. And I'll first begin with protecting our most vulnerable, which are our seniors, as well as people who are experiencing homelessness. So once again, the Health Department is going to partner with Henry Ford Health System, and we're going to support nursing homes with on-site COVID-19 testing at all of the nursing homes over the next 2 weeks, starting tomorrow. We're going to test both the residents as well as the staff. We will also support frequent testing at our homeless shelters. So if anyone is symptomatic or test positive, they will be transferred to a quarantine site where they will remain throughout the duration of their quarantine period. Now, enforcement will also take place in our schools. So with the new executive order, the K through 8 schools will remain open for in-person learning if the school chooses. All schools are required to inform the health department within 24 hours if there is a positive case. Now, when we're notified, the health department immediately sends out inspectors and they conduct a facility investigation. Also, our team offers guidance and also education as needed. Right now, there are 4 outbreaks in Detroit schools, and the majority of the cases are related to staff. And so as a proactive measure, beginning today, the health department inspectors will now conduct unannounced school visits, whether the school has a confirmed case or not. Staff who are found to be non-compliant will have to pay a $200 fine. And this is to ensure that COVID-19 protocols are in place for the safety of students as well as staff. Now, safer at work, keeping our businesses safe, enforcement will be a key step for prevention in our businesses. Right now, I want to talk to the business owners. So if you are a business owner, you are responsible for keeping your employees and customers safe. This means following the capacity limits, facial covering, and all other guidelines as outlined in the executive orders. For businesses that are in violation, you will face a $1,000 fine and also a possible shutdown for failure to follow any of the executive orders. Now, to help keep business owners safe and keep their employees and customers safe, we have developed a toolkit that is available right now on our website at detroitmeansbusiness.org. And finally, residents, I want to speak to you because you can help us. You can help us if you see something, say something. If you're out and about and you see an owner, a business who is not following the COVID-19 protocols, you can let us know. If they're experiencing a violation, it's totally anonymous. You can go online to our website at detroitmi.gov/health. You can click the box that says report businesses for COVID-19 violations, or you can call us at 313-876-4000. When you contact us, we are going to take it seriously, and we're going to conduct a full investigation. So again, if you see something, please say something. And as customers of businesses, we too must do our part in helping keep our businesses open while protecting each other from this terrible virus. And finally, each of us are responsible for slowing the spread of COVID-19. Our first priority remains the health and safety of all Detroiters, and our businesses have a key role to play. So I will continue to stress to everyone, wash your hands, avoid close contact, wear a mask, and also avoid crowds to defend against catching this virus. So our testing, our inspection, and enforcement strategies support the safety of residents and safe business operations. And so now I'm going to turn it over to Dr. Dunn, and he'll discuss
And before you do, Denise, I want to say something about what Denise Fair and the Health Department have done. Anytime any business in this city shows 2 or more people have tested positive, the Health Department goes out to figure out, did that spread occur at the job site, or did it occur after work? And in very few cases have we seen the spread at the job site. One of the few exceptions was we had a gym that was ignoring these rules, that had a number of people infected. The Health Department acted very decisively. But if somebody had known to call us to say we had a business in the city that was openly violating the rules, we could have prevented spread. And so what Director Fair has done is put something here. I don't want the governor to have to take the next step and shut down the rest of the businesses. There's no reason that should have to happen, because right now our businesses have an outstanding safety record. But if you see signs of a business, their employees not wearing masks, ignoring the rules, you can report it. The Health Department will be out there immediately. And we are going to make sure the city of Detroit remains the safest place for COVID in the state of Michigan. Probably in the last week, I haven't been asked any question more frequently than I was just exposed to somebody who tested positive for COVID. What do I do? And that question you're going to be asking more and more in the coming weeks. Somebody close to me, somebody I was with, tested positive for COVID. So we've asked Dr. Rob Dunn to take you through a few simple rules that says if somebody close to you has tested positive for COVID, what do I do next? And with that, I'll turn it over to Dr. Dunn.
Thanks. I get asked that question all the time as well. And all of us as individuals need to kind of pitch in and help take care of each other. So part of that is understanding what that risk means. So if you've been in close contact, and then people hear that term all the time, what does close contact mean? It means that you've been within 6 feet of someone who is positive for COVID for 15 minutes or more. So that's one of the key things to remember. So if you've been exposed, there's a number of things you need to do. One, you need to stay home for 14 days after exposure. You hear this term all the time, but it's something that's really important, right? Us staying away from other people when we could be getting sick is really important. While we're staying home, we need to social distance from other people in our home, and we need to wear our mask. We know that people can be contagious before they have symptoms. Some people never have symptoms. Often as many as 30% of people never get a symptom and are still contagious. So if you start to develop symptoms, we want you to get tested immediately. That's vital. That's extremely important for stopping the spread of disease and notifying others about the fact that you now have the disease. In addition, even if you don't get any symptoms, you should consider getting tested 5 to 7 days after the exposure. because you could be one of those people that has no symptoms and is positive and at risk for spreading the disease. So it's really important. We have great testing capabilities here. It's time for people to kind of remember some of the lessons learned from the spring and really, really stay focused on this. But one of the things I want to emphasize, if you got exposed yesterday, a test today isn't going to help you because it takes at least 3 to 5 days before you're going to have enough virus inside of you that we can actually test for it. So think about it as you, just like getting exposed to someone who's sick from some other disease, you don't get sick immediately. It takes a while for that to happen. So take advantage of the testing that's out there. People are not getting tested as often as they should be.
And so in the city of Detroit, we have free tests for everybody, and this is something that you can do on your own. So I was over at my sister's house over the weekend. I just found out she's positive. You need to stay home for 14 days, but after 5 or 6 days, call over to the Williams Center, get in and get tested. Because even if you don't have symptoms, you may be positive and you may be transmitting it to other people. And the reason why COVID has been such an extraordinary spreader is because people without symptoms are spreading it. That is what is driving this. And so in Detroit, we've got that testing capacity. Please take advantage of it. And the last conversation that we have to have here is one that's not going to be an easy one. I had to tell my mother this weekend we couldn't have the family Thanksgiving together, which is a really hard conversation to have, particularly in our family. But the reality is that Thanksgiving dinner is going to put the people closest to you most at risk. And Director Fair will talk about what we should be doing for the holidays.
Thank you, Mayor. So Thanksgiving is my favorite holiday, and I'm going to celebrate it differently this year. But it's hard to believe that, again, Thanksgiving is just 10 days away and Christmas is right around the corner. So per the recent executive order, in-person gatherings may only include no more than 10 family members from 2 separate households. So for example, if you have 5 members living in your home and your relative also has 5 members or less in their family, these 2 households may celebrate Thanksgiving together. However, everyone should still wear a mask. They should also remove them when they are eating or enjoying a beverage. This still brings risks, and everyone should remain cautious. Now, I know there may be some people who decide not to follow these guidelines, but I'm asking you to reconsider for the safety of all of us. We cannot allow mental fatigue from this virus to set in or just get too comfortable. Together, with support from our businesses and all residents, we will get through this. And with that, I'll turn it back over to the mayor.
All right, with that, we'll take any questions.
Thank you, Mayor. Thank you, Director Fair. Wanted to ask, how will you go about actually enforcing some of this stuff? Will it be the police department, or who might be checking some of the businesses? And also, are there any plans from the states or anything to get the TCF Center up and running again if necessary as a field hospital?
So the governor and I are, let me take the second question first. The governor and I are talking about that right now. What is the best option? We're going to need more capacity. Right now, the suburban hospitals are largely full, and they're having to send some suburban patients down to Detroit where we still have capacity. Within a few weeks, it's very likely that there won't be capacity in southeastern Michigan. There's 2 possible ways to go. One is to set up a field hospital. The second is to add capacity to the existing hospitals, convert non-patient areas. I think we learned a lot in March and April with the field hospital. The people who tend to be hospitalized tend to be the elderly, tend to be people who have other conditions, whether there's a heart condition or asthma and the like. Dropping people with chronic medical conditions into a convention center with a bunch of doctors and nurses that haven't worked together is not an ideal setting. It really is a last resort. And so we're having conversations with the hospital CEOs right now about what we can do to help them staff up, to maybe expand the capacity within the hospital, and only then will we go outside. So right now, I think the hospital CEOs and I are in agreement that figuring out how to add every potential bed into their existing buildings is the best thing for patient care. Dr. Dunn is the liaison in these conversations, and I don't know, Doctor, if you'd like to add to that.
No, I think that's right. We've been keeping a close eye on the hospitals and working with them to help them understand their needs, help them do assessments, and anticipate what those needs will be. It's one thing we've learned a lot, not just from our own experiences here in the spring where the hospitals did a tremendous job expanding their capacity and using alternate care areas within their buildings, but also from cities that have been experiencing this second wave of surge have freely shared all of their experiences.
And on your second question, the health inspectors have all been sworn in legally to be able to write the tickets themselves. The Detroit Police Department accompany them whenever they request it, but we are using more and more surprise inspections. I've certainly been disappointed at some of the outbreaks among teachers in some of the schools that appear to be happening, not among the children, but among teaching staff in the teachers' lounges or lunchrooms. It's just been, you can see what, and when we've gone in later, we found the problems. We had problems with a few of the bars and nightclubs. At this point, those are shut down by the governor. But the health department now has a very good idea where they're going. They're doing unannounced inspections at the most likely places. But if folks will use the website, and we've had people who Facebooked us or direct message to the health department to say, hey, you should check this out. The health department follows up on every one of those with their inspectors. We are going to be really vigilant the next few months because I can't have the bad businesses cause the good businesses to shut down. And that's why we're going to continue to be vigilant.
Good afternoon. I have a question for Director Fair and one for the mayor. Director Fair, can you tell us, outside of schools, where else are we seeing cases rise?
Sure. So we are laser focused on nursing homes right now. Nursing homes could potentially be a spread because they're in congregate settings, and that is why we are proactive. We're partnering with Henry Ford Health System starting tomorrow, as I mentioned, to go into the nursing homes and to test everyone, the residents and the staff, to see if there is spread. That's where we're seeing a lot of the cases.
And Mr. Mayor, you started off the bat talking about all the calls you've been getting from business owners, the casinos. We've talked to some restaurants, and they just don't understand why them and not them. You know, why us and not them? Why casinos and not gyms? When you mentioned those, you had a gym that was in non-compliance. What do you say to those restaurants and to the casinos?
You know, I'll be surprised if the governor doesn't act on gyms relatively soon. That was the only part of the order that I didn't understand. My guess is that'll have to be addressed. But the reality is that when you are in a sit-down restaurant, you necessarily have to take off your face mask to eat and drink. And there is as Dr. Dunn talks about, 15 minutes within 6 feet. That's the atmosphere where you tend to have that kind of interaction. If you go into a clothing store and buy a shirt, you can wear your mask, you have a brief interaction. You go into a repair shop, you have a brief interaction. And so what the governor is trying to do is target those areas where people will be in one place for 15 minutes or more, where they won't have a mask, and I understand that. Now, the casinos have done an absolutely amazing job. They've got the most advanced HVAC systems, and they've had absolutely no sign of spread. So I understand why they feel the way they do. There's some basis for it. On the other hand, just think about what the alternative is. If Detroit is the only place that's open, everybody is going to come here, and that puts the people of this city at risk. So I don't think the governor had any choice as far as what she did.
Mayor, we have a few questions from reporters who are watching remotely. Christine Ferretti from the Detroit News was asking if you're saying it's going to be maybe a 3-month fight. What concerns might you have about the city's budget, particularly as it relates to the casinos?
You know, the budget is not my first concern right now. My first concern is we had 50, 60 people a day, Detroiters, dying last April. My concern is for the health of the people of this city. That experience we had on Belle Isle when we celebrated the deaths, it was overwhelming in the loss this community suffered. So right now, I just want to protect the people of the city of Detroit, and we'll deal with the budget later, and hopefully there will be another round of cares when the Republicans and Democrats stop fighting with each other in Washington and get back to business. I'm very concerned about the small businesses. There was a lot of support in those first CARES packages for small businesses who had no means of surviving otherwise. They've got to break that logjam in Washington, or we're going to have a whole bunch of empty storefronts. Those are things we're going to be continuing to work on, and my hope is we get past this nonsense about who won the election relatively quickly, and we sit down and start to focus on the fact it doesn't matter if you're in a Republican or Democratic area. Every business owner in this country, unless you're Amazon, is terribly affected by this, and we got to find a way to help them.
Thank you. Question from Annalise Frank from Cranes, and wanted to know if she could get any more details on enforcement on businesses. So far, we mentioned the one gym. She wanted to know, was it closed or just fined, and are there any other examples of businesses that have been, had some enforcement efforts?
Sure. So I can talk briefly about the experience at the local gym. And, you know, I'll give a personal, my thought about this. I was very shocked. So I did the inspection along with DPD and a few of the inspectors, and what I saw was alarming. No one was wearing masks at all. And I was very much concerned. And so we wrote the business a ticket, and then we went back because we noticed from our investigations that there were almost 10 confirmed cases from that one gym. And so they, at this point, have now been shut down, and they need to create a corrective action plan of which the health department will review. And then if we feel that it meets our standards, then we will reopen it. But right now, it is closed. You know, the health department takes this extremely seriously and will continue to enforce. As the mayor mentioned, the bars and restaurants are closed, but I need help. I need to make sure that the residents are helping us with enforcement, and they can, again, give us a call, 313-876-4000, and report anyone who is violating the executive orders. And again, they can also go to our website, detroitmi.gov/health, and they can provide an anonymous report.
We probably shut down a half a dozen bars and nightclubs over the summer and the fall for violations and required them to do corrective action plans. But 99% of the businesses in this town have just been fabulous at cooperating. But it's the handful that violate that put everybody else's livelihood in jeopardy.
Okay, and looks like last question here from Violet from Deadline Detroit, wanting to know if DPD is doing its own compliance checking, if they're doing visits like they were earlier
Oh,
in
yeah.
COVID.
So Dr. Dunn could talk about that, but we are obsessed this time with the Detroit Police Department in making sure we don't have a repeat of last spring. And Dr. Dunn, who's responsible for both the police, the fire department, and DDOT, which has also had a very good record lately. But we're doubling down. And Dr. Dunn, you want to talk about what you're doing with the first responders?
Yeah, so right on through, because our first responders were always some of the people that were at the highest risk because they were continuing to take care of those patients. Even when our numbers were below 2%, it was our first responders and healthcare workers that were interacting most frequently with that 2%. So in addition to daily checks, as many people have gotten used to, getting your temperature taken and getting some screening tests, we have surveillance testing programs so that a random group of our first responders are getting tested every week to make sure that we don't have any asymptomatic spread and to try and prevent some of the outbreaks that we saw in the spring and that other places have seen as well. And that's been going tremendously well. And that's only possible because of the testing capability that the city put together with the health department.
But what we're seeing mostly at DPD and among other city workers is the spread that we've seen is gatherings on nights and weekends. It's not at work. And we're addressing that quite strongly with all city employees right now.
Okay, and just to follow up to Violet's question is, I think the point of her question was that she wanted to know if DPD was doing enforcement compliance visits at local businesses to make sure, or if it's just on the health department. And
It's so that DPD goes with the health department whenever the health department asks. So a health department is primarily responsible Health Department inspectors have the authority to write tickets. If they think there is any concern at all, DPD accommodates them, and it's been a really good partnership.
All right, thank you.
All right, thank you all very much.